Good morning from New York. This is Ronald Hamilton with the United Nations Academic Impact. Thank you for joining us this morning. 128 years ago, on July the 8th, 1892, at this time, the town of St. John's in Newfoundland in Canada woke up to a pleasant summer's day. There was really nothing unusual in either the air or any foreboding of anything that could happen that was untoward. The city's water pipes were being relayed at about this time, 10 o'clock that morning. 5 hours later, at 3 in the afternoon, one of the pipes fell in a shed where there was a lot of hay and set it on fire. That fire spread through the town of St. John's in the course of the evening and overnight, and by the next morning, the entire town had been destroyed. It was, as one of the witnesses there said, a series of catastrophic coincidences. And I brought this to mind when I was thinking of what we, as humanity, as a single Earth, as the global academic community, as the United Nations, have been through over the last 6 months. A series of catastrophic coincidences have brought us to the point where we are now overwhelmed in a sense by a pandemic, but have also used those 6 months to summon our immense capacities of innovation, of research, of creative thinking, of generosity, and above all, compassion and care to be able to mitigate, if not alleviate, the pandemic. And that's really the theme of our webinar, UN75 today. I'm very grateful to all of you who've joined us, particularly our panelists, who will be bringing different perspectives of innovation and research as we look at the global COVID-19 or coronavirus scene from the perspective of its 6 months after it first surfaced. It's now my privilege to introduce the director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health in Washington, D.C. in the United States, Dr. Anthony Fauci. Dr. Fauci.
Greetings. My name is Tony Fauci. I'm the director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. And I'm very pleased to join this global webinar organized by the United Nations Academic Impact on the subject of COVID-19, both the pandemic itself and our research response. So let's get to it. The entire world has now experienced a pandemic outbreak of an infectious diseases like nothing we've ever experienced over the last 100 years since the 1918 Spanish influenza. This, however, is a different virus, a coronavirus. In general, coronaviruses are benign viruses that are responsible for anywhere between 15 and 30% of the common colds we experience every year. However, in 2002, with the onset of the severe acute respiratory syndrome, or SARS, in China, a virus that jumped from an animal reservoir bat to a civet cat, which was served at festival dinners in China to an individual, then spreading in the human population. It did not spread rapidly, although it was a pandemic outbreak. It had about 8,000 people, and there were about 800 deaths for a mortality of 10%, a very high mortality for a respiratory illness. That was in 2002. Public health measures contained it. And then 10 years later, in 2012, another coronavirus, the Middle East Respiratory Syndrome, or MERS, again jumped from a bat to a camel to a human in Saudi Arabia, and then again another outbreak, which still smolders to today. What we're talking about today is the third pandemic coronavirus outbreak. COVID-19 is the name of the disease, and the novel coronavirus is called SARS coronavirus 2 because of its close phylogenetic relationship with the original SARS coronavirus. So what happened? It started with an outbreak in China, and now here we are with one of the worst outbreaks that we have seen, as I mentioned, since 1918. There have been over 10 million cases and 500,000 deaths globally. There's a wide spectrum of disease. As I often say, I've been chasing viruses and outbreaks for about 40 years. I've never seen a single pathogen that has such a wide range of almost contradictory manifestations, from about 20 to 40% who have asymptomatic illness, to some who have mild illness, not requiring hospitalization, to some who are at home for weeks but never require hospitalization, for those who require hospitalizations, some requiring oxygen, intensive care, intubation, ventilation, and some dying. That is a very broad spectrum of illnesses. How does that happen? It happens because of different susceptibilities, as well as some other things that we do not understand about this virus, how it can affect some people in one way and others in another. The basic biology of this, I refer to it in an article which I wrote in January of coronavirus more than just a common cold, for the reasons that I just mentioned a few moments ago. This is the phylogenetic tree. The viruses in red are human viruses. You see SARS-1 and MERS also there. SARS coronavirus 2 is very closely related to certain bat viruses and right near the phylogenetic branch of the original SARS. The basic biology that has been done and the research on that, one of the most important things was the identification of the conformational structure at the atomic level of the spike protein, which is critical because that is the protein of the virus that accounts for the so-called crown, the spikes that come out of the virus. It is also that part of the virus that binds to the receptor for the virus, which is the ACE2 receptor. The functional assessment of the entry and the receptor usage was quickly determined as we learned more about the biology. Diagnostics also very important. To understand, there are diagnostics for the virus itself, a molecular test, the material of which is obtained from a nasopharyngeal swab. You do a polymerase chain reaction to get the genetic material amplified. There are also antigen tests that will be coming online that don't measure the virus itself, but certain antigens such as the spike protein. These types of tests can be upscaled much, much more readily than the individual molecular tests for the virus. And then there are antibody tests to determine if you have been infected. You measure the antibodies to the virus. Quickly, on therapeutics, there have been a number of therapeutics that have been tested. Some have been shown to be successful. I'll give you a quick example of that. Others are broad spectrum antivirals in trial, convalescent plasma, hyperimmune globulin, immune-based therapies, and also monoclonal antibodies. Remdesivir, which is an antiviral, was the first drug shown in a randomized placebo-controlled trial to have a significant benefit on diminishing by about 30% the time it takes to recovery. This was seen in patients with advanced disease who are hospitalized with lung involvement. In addition, dexamethasone was shown by the British in a study that was in the UK that it given to individuals who are on ventilators as well as those who require oxygen compared to those who do not require oxygen compared to a placebo or standard of care. Clearly, dexamethasone diminished significantly the 28-day mortality in the ventilated patients and the patients requiring oxygen, but not on earlier patients. This is perfectly compatible with what we know about the pathogenesis of this disease, that the virus is very important early on. So to block the virus, but not the immune response early on, is the way we need to go. When you get advanced disease requiring intensive care and ventilation, it's less the virus that's causing the problem than it is the aberrant inflammatory response, which responds, as we see in this study, to dexamethasone, a powerful anti-inflammatory agent. We have put here in the United States a living document online that's easily accessible by just linking into COVID-19 treatment guidelines.nih.gov, which in real time continues to update the clinical guidelines associated with the information as it rolls out from clinical studies. And then finally, vaccines, critical to the containment of any respiratory-borne virus that has the spreading capability of this particular virus. We've adapted a strategic approach to get multiple candidates, and there are more than one candidate vaccine, to be conducted in trials in a harmonized way so that we use standard endpoints, standard and single data and safety monitoring board, as well as identical immunological parameters that are measured so that you could bridge one study to another. Here again are a number of the candidates that are already in clinical trial. You see on the right-hand part of the slide, phase 1-2 status. There will be trials that will be going into phase 3 sometime at the end of July, and then others will follow in August, September, and October. Hopefully, we'll be able to get some information, such as what this particular one representative vaccine is, a messenger RNA platform that we started here in January. Phase 1 looks good, very promising data on the induction of neutralizing antibody. It is the one that will go into trial at the end of July. But remember, this is not the only candidate. There are more than one. There are 5 or 6 or 7 that are going into clinical trials at different stages. The one that I just mentioned showed the promising results, which makes me cautiously optimistic, although you can never, ever predict with any certainty whether a vaccine is going to be safe and effective. The early data on these trials have us have a cautious optimism that we will be successful, at least in developing a vaccine with some degree of efficacy by the end of the year, the beginning of 2021. I'll close with the lessons we've learned from coronaviruses. They have pandemic potential. They're likely to continue to emerge. Good public health measures are critical to controlling them. I mentioned the spectrum of disease, which complicates control of the outbreak, and we need global collaboration and transparency if we are to get a containment of this extraordinary assault on the human population, a viral disease that spreads rapidly and has a high degree of morbidity and mortality. Thank you.
Thank you so much, Dr. Fauci. Thank you for that presentation, and both a sense of hope and reassurance, as well as extreme prudence and caution, which you shared with us. It's now my privilege to invite Dr. Christopher Meinl, who is the president and CEO of the Hasso-Plattner Institute for Digital Engineering in Germany, to share his perspectives. I also wanted to thank the Hasso-Plattner Institute, in particular its director of its New York office, Dr. Joanne Halpern, for their support and cooperation with the academic impact over these past several years. Dr. Meinl, the floor is yours.
Thank you, Rami, for a nice introduction. So our institute deals with digital technologies. And the pandemic in Germany has pushed digital transformation a lot forward. The schools were closed. So teachers and parents try to provide education material on a digital channel. The lockdown bring people in the situation that they cannot meet in person. They have to use video conferencing system and other digital means. So this is what we also had to do with our students. So in Germany, all the universities changed the teaching offers into digital ones. So this is a complete semester. It starts in April and runs up to end of July. All educational activities, all teaching is done digitally. For us as an Institute for Digital Engineering, we are specialists and we do digital teaching for a long time. So on the teacher side, it was not a problem, not so big problem, but for the students, it was terrible. To sit all the day in front of the desktop, do all the teaching work, the learnings via the desktop without classmates, without the other students, which are so important because learning is some social activity. So the semester runs and we will see how it's going on and what are the effects. So next semester, which starts in October, end of October, will done in a hybrid form. We see that in particular for the newcomers, it is so important to feel the situation in a group. We have, of course, to respect distancing and hygiene rules, but we hope we can do this because completely digital is difficult. But we had a lot of other activities. So for many years, we provide a platform, our openhpi.de, where we provide teaching content mainly in the digital area. These are these massive open online courses where many students follow a course on such a platform with social media for interacting with each other to substitute the social activities that are needed for good learning effect. 3 years ago, the WHO, the World Health Organization, Geneva, they came to us and said, okay, we have a problem. If some pandemic happens, our traditional e-learning system crashed down every time. This was the time of Ebola and SARS. So they asked, can we use the OpenHPI platform to provide the learnings for the people in the hospitals, people in public health system? So we agreed to do this, and before Corona, there were about 500,000, 500,000 registrations for the learning content. Then, during the crisis, the World Health Organization, they produced material, learnings, how to behave, how to deal with corona-infected people, how to deal with public hygienic situation, what is necessary to know about background, about the illness, about a corona illness. And what we saw during the lockdown, daily 30,000 new registrations came to this material. So today we have about 4 million learners on that platform, and you can imagine that it was difficult to get this platform running in the time of lockdown, where it's difficult to access the machinery and other things. At the end, it worked well, and it shows that we have to learn as a society in such extreme situation also to use digitalization, to use digital channels for various aspects. For us, it is in particular learning, teaching, and research. As an institute for digital technology, we also have established 2-3 years ago a department for digital health, because we see that the medical system, that medicine, that the health system is disrupted by the digital technologies. There are new possibilities for medical research, for pharmaceutical research, for the interaction between the patient with the physicians with each other. So we developed this new department, and we fastly detected that it's very important to cooperate also in a global aspect. So what we did 2 years ago, we founded an institute, an Hasselblattner Institute for Digital Health at Mount Sinai Hospital in New York. So now we have a very close cooperation with the colleagues in Mount Sinai, and during the pandemic, also our researchers, data scientists were involved in the research work of the medicine doctors in the hospital. And what they came up was with a new practice for blood, making blood more liquid. I do not know the right English word, which was taken over in the practice. So as digital engineers, as computer scientists, we can help, and we see the responsibility to help to, in in various aspects around supporting our society, supporting health system for managing this very complicated situation, which is worldwide. We also got the task to help. We developed a platform for schools, and we call it School Cloud, which provide a frame for digital work in office system and video conferencing system and messenger to give teachers and schools the mean during closed schools also to continue with the teaching. So we saw a huge increase in the number of users in schools, of teachers, of pupils in Germany. And so also German government helped to provide a more stable and more fast and more complete approach to the schools to give them a digital learning environment which can help to meet the situation to continue with teaching even when schools are closed. In Germany, the situation now is not so bad. We are quite strong here with the rules, with the distance rules, with the hygiene rules, but the public life restarts. Fortunately, we have not so many infected people, not so many death people. So we think that it's very important to use technology to manage the problems, and what was mentioned before, to be careful, particularly if people are infectious when they are not feel ill. This is a dangerous situation. Greetings to New York, greetings to all people in the world. We have to manage this crisis together.
Thank you so much, Dr. Meinl. Thank you for those words of a positive looking forward and all that you continue to do, both in your work at the Hasso-Plattner Institute and, as you mentioned, in cooperation with Mount Sinai and other institutions around the world. Well, you brought in the idea of a university, and it's our privilege now to turn to a university, the new Giza University in Egypt, which happens to be the global hub for the Sustainable Development Goal on Health and Wellbeing, SDG 3. And I'm privileged to invite Dr. Lamia Mohsin of the new Giza University to share her views. Dr. Mohsin, the floor is yours.
Okay. Being an upcoming and ambitious young school, we have always taken challenges head on in all our three dimensions, in learning and teaching, education, community, and research. However, this pandemic was really and certainly a curveball, and it made us assess the situation rapidly, swiftly, and enthusiastically to manage the change. Being a UN academic hub, the SDGs are always the forefront of our planning process, and we are always trying to improve the quality and the standard of people's lives and positively contributing to the SDGs 3 and 4, of course. In the teaching and learning part, we coincided with all learning technology developments, and we began at the beginning to record the lectures and place them on the university electronic platform, or what we call our Moodle. So the students can really watch them safely from home and keep their education on track. But because we always take students' feedback and experience into consideration, as we were delivering recorded sessions, we started simultaneously to prepare a transition to live interactive sessions. We worked on orienting and familiarizing all instruction with the platforms, and then training each and every faculty, teaching assistant, or administrator on really how to deliver a virtual online session successfully. But at the same time, and due to the turbulence of the student lives, of their schedules, of their sleeping hours, some of them traveled, we settled on delivering a hybrid of live interactive sessions, which were recorded and then uploaded later for convenient viewing. Exams also were delivered online for the first academic years. This was done through the lockdown browsers, and this necessitated carrying on a lot of mock exams for students to allow them to familiarize themselves and feel comfortable with the software. This was really challenging because students thought that using the webcam was jeopardizing their privacy, and it took a lot of discussions really to have them convinced that this is really important to have it. Easy access to the NGU IT department made this challenge again easily, as students were given on daily basis the opportunity to tackle any technical difficulties or inquiries with the IT department help desk. This was for year 1 till 3, but year 4 had to sit their exams in person in campus. And once again, this raised a lot of challenge because we had to take all reasonable precautions, spreading our examinees to maintain social distancing, to mandate temperature checks, give masks on campus, give access and flow to students, and reduce handling of materials as much as possible. Sanitizers, we had to make them ready everywhere. Those who could not make the exam on campus were, of course, due to travel restrictions, due to health conditions, due to any obstacles, were allowed to sit the exam at home using the lockdown browser. We had to have, this was dealing with the acute short-term thing, but we had to have a plan for sustainability. And we are committed to continue online learning for lectures for the coming academic year. We don't know, maybe the first semester, maybe for both semesters, and we are committed to taking all precautions during conducting large and small group work, practical and clinical sessions, which are supposed to be conducted on campus. Again, we are getting ready for next semester admissions, and we are adapting online admission protocols where interviews for new admissions are conducted online to facilitate the admission procedure. Co-videos were done on Teams on the Teams platform by teaching assistants and assistant lecturers to support the students and give them tips on how to cope and prosper during the pandemic. Also, our team of teaching assistants created an awareness poster. They made it and illustrated it and sent it to all students and staff. Students as well had a role. To help in poverty alleviation during the pandemic, they created their own initiative, helping raising money to the Egyptian Food Bank. And this was for the sake of the day laborers who were disproportionately impacted by the lockdown. And to be aligned with the academic impact principles of freedom and inquiry, and with more than 400 attendees, New Giza School of Medicine conducted an interactive webinar that was titled COVID-19 Updates. This was initiated and organized mainly by the students. And really, this was the key strength in it. And it was presented by our concerned and esteemed professors. On the research as well, we really felt we had to be on the front, and the research division at NGU was upfront on the COVID-19 emergency. A grant was submitted to the Science and Technology Development Fund to conduct a research tackling the COVID-19 virus port of entry via drug repurposing rather than recombinant proteins. And this renders the approach fast, reliable, and convenient. And the grant is initially accepted and shortlisted among the high priority proposals to fund. This was a collaboration. This grant proposal is a collaboration that was initiated and written by a research team at New Giza School of Medicine in cooperation with Southwestern University, Texas, USA, as well as the NGU School of Pharmacy. To sum up, really, this time is very challenging. Being a new school, we already had challenges, and this added up a lot. But again, we had the opportunity to find out that People are really working very hard under stress, yet they are very enthusiastic and they are keen to maintain the vision and the mission this School of Medicine has. Thank you.
Thank you so much, Dr. Mohsen, and thank you for that wonderful resonating phrase of mission and vision, which you encapsulated so vividly. I'd now like to ask my friend and teammate, Omar Hernandez, to introduce our UN75 survey, which I hope that you will take a minute to complete, and to continue the program with our following speakers. So over to you, Omar.
Thank you, Ramo. Indeed, as you may know, the United Nations Organization is celebrating this year its 75th anniversary after the foundation in 1945. And the United Nations wants to know what people think about not only the UN, but the pressing issues in the global agenda and the role of multilateral cooperation to address these issues. And for that, we kindly invite you to fill out the UN75 survey. This is a way, actually my colleague Brenda has just posted on the chat box the link. It just takes a minute or even less. The survey is available in multiple languages, not only the languages of the UN, the official UN languages, but also in multiple others. It's basically a set of very brief questions. I'm going to very quickly read them. What should the international community prioritize to recover better from the pandemic? How do you see the world 25 years from now? Which of these global trends, the ones that are listed there, do you think will most affect our future? How important or not it is for countries to work together to manage the trends that are listed there? Has COVID-19 changed your views on cooperation between countries? And finally, do you think that people in 2045 will be better off, worse off, the same as you are today? And then there's a space for those of you who would like to comment on how would you advise the current UN Secretary General to address these global trends. So we kindly invite you to fill out this form. Afterwards, in the follow-up email, we're going to once again send you the link to fill out the survey. Now, it is my privilege to invite our next speaker, Dr. Daniel Wuba. He's the president of Millersville University in the United States, a fellow of the American Association for the Advancement of Science, and he testified before the UN Congress on how to prepare the science workforce for the 21st century. He's a microbiologist by profession with research projects funded by the National Science Foundation and the National Institutes of Health. Dr. Wuba, you have the floor.
Thank you very much, Omar and Ramu, for moderating this session. I would like to share with you what we have done here at Millersville University, as well as what is going on nationally in the US and when it comes to higher ed's response to the COVID-19 pandemic. As most of you are aware, the COVID-19 pandemic forced higher education institutions in the US and indeed around the world to adopt new ways of doing things overnight. So for example, in our case, we had to bring our students who were doing study abroad back home starting in mid-February. And around the same time, we activated our incident response team on our campus. And this is a team made up of about 45 individuals who represent various units across the campus. We then quickly had to transition entirely from face-to-face instruction to remote instruction, and that required preparing our faculty members as well as our students. Within a 2-week period, we sent thousands of our students home while providing residency for those students whose safety depended on staying on campus. For example, our international students and domestic students who were shelter insecure. At the same time, we coordinated with local and state agencies. And in this case, the goal was to make sure that whatever we did will impact the entire community. So we also work with our healthcare facilities and businesses to support emergency response activities and to provide for the health and safety of everyone in this community. As I mentioned earlier, throughout this process, our highest priority has been and will continue to be the health and safety of our faculty, staff, students, and the surrounding community. In the spring, We allowed only essential employees to come to campus after our governor issued a directive of stay at home. And this went on for about 6 to 8 weeks. At the moment, we are preparing for the fall semester. And we intend to use a hybrid instructional modality. This will involve a mix of online and face-to-face instruction. We are currently upgrading our classrooms to support multimodal courses with some students in the classrooms and others connecting remotely. We have increased our cleaning, disinfection, and sanitation efforts across campus to meet CDC guidelines, and we require everyone on campus to wear a face mask. We are also putting in place a contact tracing app that will be used to ensure that we have proper density across campus, especially in the fall when our students come back. So I want to use the rest of my time left to talk generally about what the role of higher education has been in addressing this pandemic. As we all know, education is critical for understanding any kind of social disruption. And in this case, education has really played a big role. Higher ed institutions are rising to the challenge and leading efforts to avoid the spread, as well as to develop therapies, including a vaccine, as Dr. Fauci said earlier. University researchers are working towards better understanding of these pandemics. And just to share with you a few of those examples, at University of Davis, there's a team of experts who ranging from epidemiologists through global health experts who are trying to decipher how to handle this disease. When it comes to, let's say, the bioaerosol transmission of the disease, we know that scientists at the University of Colorado, as well as University of Maryland, were actively involved in determining that the virus could be spread through aerosols. And through their advice, they were able to actually work with COIS and Performing Arts Group not to gather until a vaccine was found. Another important role that higher ed has played, of course, is to help with mapping the spread of the virus. In this case, Johns Hopkins University has been a leading institution in doing so. They actually are using university-based computer models to help map how the pandemic is spreading and keep track of the pandemic nationally, as well as globally. And they are providing decision makers with data to help them evaluate critical trends and how to address this pandemic at a global level. Now, what are we doing at Millersville University? At Millersville University, one of the areas of strength is in emergency management. And so in this case, we are developing planning guidance and mitigation techniques to help with national, state, and local response strategies. I'll just mention one example of that. We have two of our faculty members, Dr. Dwayne Hagelgans, who is a professor of emergency management, and Dr. Sepi Yelda, the director of our Center for Disaster Research and Education. And the two of them have worked together to provide techniques and guidance that have been instrumental in supporting our response and coordinating local activities. So they've developed handbooks that are being used in our community here. The last thing I want to talk about has to do with the vaccine development and the treatments that I mentioned. And in this case, the University of Pittsburgh, and the Center for Vaccine Research there is one of the lead institutions, as well as at MIT. And there's a COVID-19 Rapid Innovation Dashboard Catalog that basically helps one get an idea of how the pathogen is spreading. So in conclusion, across the higher education landscape, we are using the power of the practical application of knowledge that's developed in university labs and research centers to address this pandemic. And through public and private partnerships and collaborations among a global scientific community, we recognize the magnitude of this pandemic, and higher education will continue to contribute towards addressing the impact of the pandemic. Thank you. I look forward to answering any questions that will come up later.
Thank you very much indeed, Dr. Wuwa, for not only highlighting what Millersville University is doing, but also to explain to us the involvement of the faculty and the critical role of colleges and universities, not only in the US, but around the world to address this pandemic. So thank you very much indeed. Now, last but not least, it is my privilege to present to you our next speaker, Dr. Padmini Murthy. She's a professor and global health director at the New York Medical College in the United States. She's an expert in public health, certified health education specialist, and NGO representative of the Medical Women International Association to the United Nations. Dr. Murthy, you have the floor. Thank you very much.
Thank you so much, Mr. Hernandez, and thank you, Mr. Damodaran. At the outset, I would like to express my sincere appreciation to the UNAI team for organizing not only this webinar, but all the other webinars, which have been so informative. And may I take the liberty of saying that you are our connectivity during the COVID crisis, CCC. And also, I would like to express my gratitude for this opportunity and thank my esteemed colleagues who have gone before me. And just to shift gears slightly, I'm putting on my public health physician hat here. And I would just like to briefly discuss what global communities are doing worldwide, and also touch briefly upon mental health, because what happens is that mental health is a big issue. It's a challenge we are facing. So one of the things, yes, we are all now we don't want to have plastic bottles. We are trying to move away from plastic. But let me share something with you, ladies and gentlemen, that globally, communities are making use of plastic products, glass to create barriers, and socially distance from one another as the lockdown is being eased. For example, you have plastic face shields, suits made of softer plastic, which is enabling family members to hug one another, especially grandparents who want to hug their grandchildren and yet maintain safety. And now there are so many innovative ways where slowly, places are opening up where people sit in little plastic tents or cubes, glass cubes, where they're enjoying their meal, but at the same time, they're socially distanced from others. So as a public health physician, let me tell you, the coronavirus is not tired of infecting us. And it's not concerned that it's going on unabated. So we need to really follow some simple rules. Dr. Fauci has so eloquently talked about that, being a global health expert. And I would just like to reiterate that we need to wear a mask and hand wash. It's not that it's being repetitive, but we cannot say it enough. And there has been research which has just been published recently that the countries like Korea, Hong Kong, China, Thailand, where masks have been used from the beginning, socially distanced, and they used track and trace, the number of deaths is less than 6 per million. So this really tells us that this works. So, and the other thing is, looking at it, we are all global citizens, as was so eloquently, said by my colleague from Egypt, my colleague from the university president who just spoke, and our German colleague. One of the things is we need to respect each other. So wearing a mask, ladies and gentlemen, is respect, expressing solidarity. And it's more than that, it's a very important public health safety measure. And I was on a webinar a couple of days ago, and one of the people who called in from Nigeria, very interesting question. She said, can you tell me if you feel choked wearing a mask? I am scared wearing a mask because I feel my oxygen supply would get cut off and, I can't breathe. So I explained to her that I have been a physician for so many years, and the person who was interviewing me was a nurse, another professional colleague. And I said, we have been wearing masks even before the corona started. Like when we see patients or when we are in the ER, we haven't felt choked. And I explained to her, it is not a gag, but it is a protection. So the reason I brought this up is, I know with all the great work, the UNAI is connecting universities. And when students see this, let them understand that, anybody, that mask is protective. Nothing is 100%, but it does give us a fair amount of protection. And I would like to, as I'm summing up, I think this message, which was so eloquently put forth by the Honorable Secretary General of the United Nations, Antonio Guterres, from an op-ed in the Time magazine, to quote him, "Unless we act now to address the mental health needs associated with the pandemic, there will be enormous long-term consequences for families, communities, and societies." And the other thing, it's just not the general public, even we as healthcare professionals, first responders, people working, we also have stress. There is burnout because physically and emotionally you get burnt out. Physically, if you rest a while, you're burnt out, it does help you, but mentally, it's really hard. So some of the simple steps which experts have recommended, which I just want to share with you. And this is what I tell my students being a professor. And then when we physician colleagues, talk to each other about what we are doing, we share tips on what we teach our medical students and students of public health, because as everybody, online teaching has been slightly challenging, but we are finding innovative ways to do that, get the message across and stay connected. So one of the things is, please avoid excessive exposure to media coverage. And I am guilty of that. I'm watching CNN and I go like, okay, what is the latest news? But now recently I'm reducing my watching to only one day. And also we need to keep in touch. So please reach out. Yes, we are physically apart, but communication brings us so much closer because of the technology. Send a WhatsApp message. Just if you have an elderly neighbor or somebody, just reach out and say, how are you doing? Because in spite of the COVID, we need not lose touch because we can use technology to communicate. And also the other thing I just wanted to share briefly as I finish is that masking is really, really important because scientists recently have compared it with herd immunity, and also because it's a way of giving protection. I mean, it's not that it is the same as herd immunity, but I think that is a very important comparison made. It's just to say how people, it protects people. So the last but not least is please communicate, stay in touch with your students. And one of the things I have found teaching online is I always put a message every week under announcements on the platform we use. And at New York Medical College, we have a pretty robust platform, and we are reaching out to say that, how are you doing? Do you want to talk to me about anything post-COVID? So thank you all so much and look forward to the discussion. Thank you again.
Thank you very much indeed, Dr. Murthy, for your presentation and for underlining the importance of the protective measures as well as the relevance of mental health that somehow it might be neglected when it comes to addressing the pandemic. So thank you very much. And now we are proceeding to the interactive session. So we will have a moderated discussion. So those of you who would like to ask questions to our panelists, we kindly ask you to write down those questions in the chat box. Please indicate your name and affiliation, and then the questions as short as possible, and we will pass them on to our speakers. First, if I may start this discussion, I would like to ask Dr. Meinl from the Hasso-Plattner Institute. You mentioned cooperation with a very well-known hospital here in New York. In terms of what has happened with this pandemic, how do you see any lesson learned from what cooperation should be from now on in terms of research, and how institutes of research and think tanks should cooperate more in what areas with hospitals and health facilities? So thank you very much.
So we are looking to the topic from the digitalization, digital technologies. And this was also clear before of the pandemic, that this data science approach, this digital technology in medicine, for medicinal research, for pharmaceutical research, became more and more important. Particularly if I speak about an example from data science, there are side effects, for example, of certain medical drugs. And nobody understands why some people have the side effect, others have not. We strongly believe if we look closer in a larger community, not only in a single hospital or in a single country, if we look on a global view to compare people and their constitution with such side effects and without, that we will detect differences. And these differences eventually in the genetic structure, eventually in other things, environmental structure or whatever. And these insights will help to predict for what type of people one should work in therapy with such drugs and for what not. Particularly here in the pandemic, we have this huge effect of many, many people which are infected. So with data science methods, it makes sense to compare what are the treatments in this hospital, what are the treatments in that, and to compare also the effectiveness and the results. And these are much more broad understand after the pandemic crisis than before. Before it was sometimes difficult to explain to the people here that is, although it comes not from medicine, it comes from quantitative science, from computer science, from data science, that it helps to push medical research, medical insights forward, and as well also in a broader view, if you look to the health system as a whole in a country, compares different countries to understand why is the one very costly and same time not so efficient. We another system which works with less resources and similar results. This will help us worldwide push forward in a strong exchange of such insights.
Dr. Meinl, if I may, David from our audience is asking if the use of geospatial technology could be used for contact tracing. If you can comment on that very briefly.
So in Germany, there was an effect that after the lockdown, immediately the number of people which were infected of influenza dropped down. So one could very fast see the effect of such distancing approaches. And when we see, for example, look to South America or other very crowded societies, then we will understand that's much more difficult in such an environment to hold and see the effect of distancing like in other societies. So we believe and see that it's very important. And in Germany, that is yet not from our view, but there is a general consensus that also masks are helpful. In the beginning of the crisis, most of the people say, no, it will not have any effect. But meanwhile, there are a lot of explanation that there is an effect of distancing and having masks when you restart public life.
Thank you very much, Dr. Meinl. Dr. Murthy, we have a couple of questions for you. The very first one is if you could talk very briefly about the possibility of the virus, a possible virus mutation. And then in terms of division of classes and intentionality of classes, some people might not have technology or access to technology to properly, for example, access to education or order food online. So how can we, in the response to the pandemic and the healthy measures, how can these measures be applied to some people that do not have access to these means?
Thank you so much, Mr. Hernandez. I'll do my best. First of all, the COVID virus belongs to the RNA family. There are viruses which are RNA and DNA, which are sounding too technical. And yes, the virus can mutate, but ladies and gentlemen, it's not going to mutate in a day. Every virus during its life cycle can mutate. So the answer is yes, it can mutate. as all viruses do. But at this point, we are not sure of how long it takes for mutation. And that being said, I mean, some of these mutations are very slight. There are different strains of viruses. So the answer is yes, but that's no cause for alarm. So that should not, give rise to, hysteria or something, because it's a part of the natural cycle of the virus. That is the answer to the first question, Mr. Hernandez, which was posed. And I thank you to somebody who posed that question, because that was really important. The other thing with regard to technology, well, I'm not a technology guru, but one of the things I have found working in, countries where the internet, it's, as you said, technology is hard to get, like radio shows. I have found that using the radio shows, and some NGOs have tried using it, having broadcast, because in this time you cannot have a traveling show which tells you about social distancing, because that is totally against what we are trying to say. And also the other thing I found is some of the apps also can transmit a lot of information. And as you know better than me, Mr. Hernandez, and your team working in the Department of Global Communication, the number of cell phone users are so high. They're in billions in the world. So there is a way of communicating, even through messaging, or even using the radio or other apps on the phone. I hope I've answered your question as best as I can. Thank you.
Thank you very much indeed, Dr. Murthy. Now I have a question from James to Dr. Wuba, whether they have considered at Middlesbrough University in-person classes for small classes and cohorts as a way to partially returning to class on campus for the next semester.
Thank you, Omar, for the question. Actually, for the fall semester, we are using what we call the hybrid multimodal approach. So in this case, we will have some students who would still come to the classroom and have face-to-face experiences. For example, students in the sciences who need to do the labs will be coming to the labs, practicing social distancing. Students in music, the performing arts, who have to work on their instrumentation would also be doing the same. As we speak now, 52% of our classes are, in this mode. And for the other 48%, we'll basically have them strictly, available online. But before, I also want to talk briefly about the geospatial technology platform. We are currently using an app that is being developed by a private company. And what this app will allow us to do is through the cell phone. So as soon as anyone enters our campus, the person will be identified as a blue dot. It's anonymous. And that person then can be followed throughout the campus while the person is here. So for example, if we have a room that at the moment needs to take only 20 people, and we see 25 dots in there, we have someone, we're going to assign a person who would go in and make sure that, we bring down the density to the appropriate level. So we are also using that for our contact tracing, using the cell phone, and that's a mechanism as a way of tracing people on campus to get the density right.
If I may add, Dr. Wuba, to the previous questions, what's the role of medical practitioners and scholars at the university when designing these measures for the next semester?
Could you please repeat the question?
Yes. What was the role of the medical practitioners and the medical services at the university in the designing of these measures when returning to campus, even in a hybrid modality for the next semester?
They are actively involved. Our incidents, actually on our campus at the moment, we have a task force that is involved in the whole reopening of the fall semester. And on this task force, we have our health, care providers there, our physicians there. So they are involved in making sure that, for example, in every room, based on the size, we know the number of students who can be in that room at a particular time. Also, as our employees come to campus, they have to report to our health center, get their temperature taken. So we are actively involving our medical practitioners on our campus and our healthcare providers in all that decision making.
Thank you very much indeed, Dr. Wuba. Dr. Mosen, you were mentioning the research that has started in relation to do findings related to the ongoing pandemic. So if you could comment on the challenges of conducting research sort of in the making while the pandemic is still happening? What are the challenges not only for the researcher but also for faculty and students?
Yeah, the challenges are funding mainly. And again, we being a young university, we do not yet have an affiliated hospital. So we have to have, through the collaboration with other institutes, hospitals in which we can take the patients from to conduct the research. But otherwise, apart from these two challenges, I think it can be done.
And we have seen that in the website of New Giza University, how the community hospital has been used to create awareness on the importance of the health measures that needs to be taken by the community. If you could elaborate a little bit more on that.
Yes, we have a community hospital. It's a daycare. And patients come, it receives patients referred from all around the country. Clinics are conducted there, and awareness sessions were conducted. Awareness sessions were conducted by faculty and by the students to those who are attending the community hospital for daycare, coming for the clinics and then taking daycare and leaving. But students will be going on regular basis to this community hospital effective this September.
Thank you very much indeed, Dr. Mohsen. And to any of our panelists, someone is asking that if the virus is getting more lethal or more contagious, nowadays, given the news that we have seen recently, not only in the US, but around the world, what about the development of immunity and so on? So if any of the speakers would like to address this question. Maybe Dr. Mohsen or Dr. Murthy?
Excuse me? Excuse me?
Yes.
Yes, can you repeat the question, please?
Sure. If you can comment on the possibility of the virus being more contagious and more lethal now, and what about the development of immunity for the people?
No, actually, in Egypt, what we can see as observations that it is very, very highly contagious. It is disseminating very, very rapidly, but the observations are going that the severe cases are becoming less. This is what we have in observation, and the numbers as reported by the government are as if we are plateauing.
Okay. Dr. Murthy, if you would like to comment on this.
Yes, thank you. I just wanted to say that it is still uncharted territory. And just to add to what my esteemed colleague said, the cases, there is, I think, in some regions, there's a plateau. But the other thing, if you have noticed, at least in the US, the number of younger people getting affected has become more. And also, unfortunately, it's as I said, it's uncharted water. The reason I say it is people who've had comorbid conditions, like what we have learned, I mean, that if they have diabetes, underlying lung conditions, or hypertension, they're at a higher risk. But it is interesting to see, I hear that from my physician colleagues, and I see that some of them have recovered, and younger people who have not had any existing conditions. And just let me tell you, recently the Broadway star who passed away, unfortunately, he had his legs amputated. He fought for over 3 months, and unfortunately he succumbed to it. So it is definitely contagious. At this point, we do not have a vaccine. I think my other esteemed colleagues talked about that briefly. But what we need to do is we need to practice good judgment, social distancing, wearing a mask, hand washing. It is not to be a trifle, because even in New York, I'm from New York, and our numbers came down because everybody practiced, these public health measures. And just to sum up, because public health measures here, it's a calling for people. It's not telling somebody, it's not imposing a will. You're just giving an opinion based on evidence. So with regard to immunity, I think that we will know that in the future, because we still don't have a herd immunity, Mr. Hernandez. That is the problem, like some of the other diseases have. Maybe a few months or a year down the road we may, but looking at it from a public health perspective, we just have to be cautious. And that too, because as my colleague from Egypt just mentioned, this is also going so fast, and it's also now airborne. There is so many reports, as you can see. So we have to be careful. We are working with an enemy with very few tools. So we need to use our common sense and work collectively and collaboratively. Thank you again.
Thank you, Dr. Murthy. Back to Dr. Meinl, Dr. Wova. Hasham is asking if, in terms of education, when it comes to online learning for students, is there any difference that can be seen depending on the cultural background of the students to either access online learning or to process online learning? So, Dr. Meinl, if you can comment on that.
There is a difference between people that need for learning a group and those which are autodidactic, gifted, which can also learn alone. The second group is very small. So typically we have organized all over the world all our teaching as a social event. We sit together, there is someone teaching or training or coach, and the group also interacts with each other. In the online learning world, we have modelized this with the massive open online courses. This is a platform, provide material. The learners are synchronized because it's organized as a course, and the platform is married with social media. So the people that follow the course can interact on the discussion forum on the social media. So the massiveness is needed that many learners are on the platform, so that this interaction via this discussion forum becomes very interactive. And this interactivity, this binds people to the platform content. If you only have the content without the social interaction, then it depends from your whether you are a gifted person which is able to concentrate and autodidactic is learning, but most people are not. Most people like to have this group, need the group to be pushed forward, to have help in situations they cannot understand. So I do not see this in the multicultural difference. I see this more in the personal difference, how we learn.
Thank you, Dr. Meinl. Dr. Wova, if you can comment on that.
Yes. At Millersville, and I think this across universities in the US, and when we talk about the impact based on the multicultural backgrounds, it's actually often overlays also with the socioeconomic status. So for example, at Millersville, 33% of our students are Pell eligible. They mean they are students from a lower socioeconomic status. And for most of these students, they need additional support during the pandemic. At the time when we sent students home, in mid-March, we had to ask questions such as, for some of these students going back home, would they have access to the internet? Or would they have the proper environment to be able to take their classes online? There were some students that we actually had to help with institutional funds. So we immediately developed that we set up a compassion fund. And we asked our alums and that's anyone who supports the university that's basically contribute to this. We were able to raise $40,000, and there were some students who actually applied to this fund to be able to pay for their internet access or even to buy other devices that they need to be able to take their classes online. That was what occurred immediately, but we also had international students. For example, for our Chinese students, we had a cohort of about 40 students. During the time when we sent students home, we had to have one person who was working with them on a daily basis because their parents were very worried as to what was going on. All that has an impact on their educational outcomes, because if the students are not in the right mental state, they would not be able to perform academically well. So we use the holistic approach in terms of supporting our students, making sure that we care not only for their cultural, that's their classroom experience, but also the extracurricular needs that they deserve to be able to do well. But I just want to add, it's not only on the students. In the US, as you know, we've had a lot of social strife recently, and with all these protests. So our faculty and staff, who are also from different multicultural backgrounds, are also feeling the impact, especially the underrepresented, that's faculty and staff. So we've actually been holding what we call a gathering as a way of healing our community. And we had one where we had more than 200 participants. And we started with a general discussion. We went into breakout sessions and then came back with suggestions about how to keep our community healthy in the with the current situation that we face in our nation. So yes, we pay attention to the impact of the pandemic, which has really exposed and the inequalities when it comes to support structures that are in place and experiences of multicultural people in our community.
Thank you very much, Dr. Wuwa, for your response. If I may ask Dr. Murthy to comment on what's the community involvement of students at the university where you currently teach, because we have these social distancing rules and medical students, they need to connect with people in the field, not only in the hospital, but with the community. So how this is going to be from now on, given the social distancing norms?
Thank you so much, Mr. Hernandez. Well, with regard to, your question has two aspects. So as with the other schools, we are using distance learning to teach them. And as you know, the medical students, they are like the first and second years, it's like more classroom teaching. And when you later on, when you come to the third and fourth year, you go into clinical. So that is being looked into, and every precaution is being taken to socially distance so that the students are not endangered in any way or put at risk. And the same thing with even the attending. So basically you are gloved, you're masked, and you have, you are maintaining that distance. But that being said, again, it's a little challenging when you're dealing with patients because you cannot be always 6 feet away when examining a patient. But all the CDC guidelines and the protocols are being observed as with any healthcare facility. You just do your best. And also, as much as we can for the students, at least it's been like the didactic has been on using on learning modules. So it's the clinicals too. Every precaution is being taken, which is being done in all universities where you teach medical students and have residents and doctors delivering patient care. Thank you.
Thank you very much, Dr. Murthy. And now we close this part of the webinar, this moderated discussion, and I hand it over to Ramu.
Thanks so much, Omar. Thank you. And my gratitude to all our distinguished panelists. I think Dr. Fauci really set the tone, not only for our 75 minutes of conversation, but for our global response to this pandemic when he spoke about the imperative of global collaboration, which all of you have attested to, and transparency. And for us at the United Nations, we as an organization are committed to transparency, and it's a fine line to try and determine where transparency ends and where rumors, falsehoods, misinformation begin. And this is why we turn to you, the global academic community, to be able to sift fact from what is falsehood. And above all, at a time like this, when we are confronted with a crisis so intensely personal in nature, combine fact with tact. So all of us at the Academic Impact are very grateful to each one of you. Dr. Meinl, thank you for your presentation and your exposition of how your institute and universities are dealing with, as you mentioned, a hybrid form of learning. I know that you are the patent holder of LockKeeper, which is a security system for computers. And the definition of LockKeeper, which I found on the internet, is that the the ultimate way to secure a network is to disconnect it. And if you take that metaphor to what we're confronted with now, the ultimate way to protect ourselves and others from the pandemic is to disconnect them from it, whether through distancing them from formal courses at a university, or as Dr. Murthy mentioned, insisting on the barriers of protective equipment and masks. So we need that disconnection now more than ever. Thank you very much for that insight. Dr. Mohsin, you spoke about the clinical studies, and you also mentioned that being a new university, New Giza University, does not have an immediate affiliated hospital. And yet you have been working with other institutions and the community to get your patients and your doctors and ultimately your students the experience that they richly deserve. I was also very moved by a reference to the role of your students or their contribution to the Egyptian food banks, looking after daily laborers, because one of the very first reports that the UN Secretary General Antonio Guterres did in the context of COVID was its socio-economic impacts, because we do tend to be preoccupied with the medical, the health, and the safety aspects of the pandemic, but it's sometimes easy to ignore the devastation it causes to livelihoods of people, of their lives, especially, as you mentioned, Dr. Mohsin, when you have daily laborers. So our congratulations and deep gratitude to your students.
Thank you.
Dr. Wuba, thank you. Dr. Wuba, thank you for highlighting the power of practical knowledge in dealing with crises. And you have a formidable record from your student days in Ghana to the presidency of Millerville College that you now hold, and of course your stellar role in the Association of American State Colleges and Universities, ASCO. And I'm sure you will be able to weave a tapestry within this country and within that network, where even as we confront the pandemic with which we are faced at the moment, we still are resolved to be able to deal with future ones, or, as some people speculate, a recurrence or resurgence of the one that we are witnessing now. And thank you for that commitment from the global academic community, or as you put it, the global scholarship community. Thank you, sir.
Thank you.
Thank you. Dr. Murthy, we have known each other for a great length of time. You are a friend of the Department of Global Communications and the United Nations Academic Impact. You bring a formidable combination, both of scholarship as a medical teacher and professional, and as a vibrant civil society representative. And all of us in the Department Civil Society Unit are aware of what you and your organization have done, getting relief supplies and personal protective equipment to audiences as diverse as Mother Teresa's Missionaries of Charity in Calcutta in India, or the Navajo Indians in this country. So the idea of being able to combine cerebral knowledge with care, which, as you say, is the hallmark of the medical profession, is imperative. And I think the last point that you mentioned about the two needs that we must always keep in mind. One is the absolute need for respect. So we are not inconveniencing ourselves by creating barriers like a mask. We are extending respect to others whom we do not know, but whom we may unwittingly infect. And of course, your point about mental health. I think this is something which we are undergoing throughout the world, and I can testify to this from my own home country of India. It is a time of enormous stresses in terms of people's mental well-being. Not only the fear of the virus, or the fear of what might cause to them medically, economically, socially, but also the proximity of space, of dealing with unusual situations, of working in unfamiliar situations, as someone said the other day. It's not that we are working from home, it's that we are living at work. So lessons like that, we are very grateful, Dr. Murthy. So my thanks to all of you for having joined us. My thanks, Omar Hernandez, who put this event together, and our wonderful team, Lanice Collins, Bo Lee, Brenda Waba, Dari Dambayeva, Dalita Melo. We look forward to welcome you to more of our webinars. Our next two webinars, and you'll find details on our website, are going to be in Portuguese and in Russian. So if you are familiar with either or both languages, please do join us. And then we will be back on the evening of August the 5th, New York time, which is the morning of August the 6th in Japan, for a webinar to commemorate the 75th anniversary of the bombing of Hiroshima and Nagasaki in 1945, and look at how we can rethink disarmament. Thanks very much, and have a wonderful and productive, and above all, safe day. Bye-bye.